My name is Paula Glover, and I'm doing my presentation for my internship for the master's program. I did my RTI, and I'm going to explain what my project was in defining wearable technologies for optimal use, and then some considerations and recommendations about that. RTI is an independent nonprofit research institute dedicated to improving the human condition. It's headquartered in RTI, so Research Triangle Institute, and also the park as well in North Carolina. And this was established in 1958 as part of a partnership between government and educational sectors wanting to increase expertise in research insights into a variety of different fields. And RTI also has a lot of different partnerships with different North Carolina universities, UNC included. So there's 24 offices worldwide covering 8 subject areas, and I included each one just so everyone can see that they really do a lot of work in different areas and try to improve everyone's way of life throughout the world. So I have health here highlighted just because that's going to be the focus for today. And you see that there's a lot of different policy areas and practice areas within this subject. So specifically, RTI's digital health and clinical informatics team works with clients to explore how patients and clinicians can use technology to improve individual health, self-management, population health, and provider-based healthcare. And they do a lot of work with evaluation of design and usability of health IT, so health information technologies. And I have 2 of them highlighted because those are going to come into play a little bit later. So specifically, the digital health internship was a collaboration with DHCI, and it was designed to teach students skills in implementing and evaluating digital health devices within healthcare projects. And this was my mentor, Robert Ferberg, and he does a lot of work with DHCI in implementation and evaluation of digital interventions. And also Alexa Ortiz, and she also helped with us throughout the summer, and her work is mostly in innovative uses of health IT. So the theme for our internship overall was consumer wearable technologies. So mine is the first one highlighted. So defining consumer wearable technologies accurately, given current developments and use contexts. I also had 2 other cohort members, also in the PSM program, and they did work related to consumer wearables. So one was understanding public opinion concerning consent and security of patient-generated data, and the next one was in heart rate variability. So understanding how to capture that using consumer wearable technologies. So defining consumer wearable technologies through evaluation of key product attributes. So this was basically my project objective to develop a qualitative review of the current landscape of consumer wearable technologies and then define those comparatively against other devices within the same category of technology, just so everyone can use them appropriately according to their use, and then evaluate consumer wearable technologies outside of traditional quantitative comparisons. And then these are some of the questions that I was going to try to answer with this project. So we have how can we synthesize available literature around this subject? What characteristics of consumer wearable technology, what are the characteristics of consumer wearable technologies, and how do these characteristics compare with clinical grade devices? How much overlap exists between consumer wearable technologies and clinical grade devices? And then how do we categorize this overlap? Is there any current literature seeking to address classification guidelines for use of consumer wearable technologies qualitatively? And is there an available framework or a set of guidelines for use of wearable technologies? So the first part is the synthesis of literature on the current landscape. And so here I outline my search strategies. So basically just reviewing publications. So I have JMIR, PubMed, Science Direct, as well as other different websites using Google that focused on consumer technology and healthcare innovation. And then some of the search terms were, of course, consumer wearable technologies, but then also things like fitness trackers, activity trackers, and specific terms for different ways that these trackers measure data. And the inclusion criteria for this was had to be marketed to everyday consumers, so anyone like you or I that could easily just go and pick up one of these fitness trackers or health devices. It must have had some sort of health or fitness purpose, so some devices are just mainly for everyday use for convenience but don't have a health aspect to that, so we wanted to get rid of those. And then anything that was in a watch-like form just to kind of narrow our scope down a little bit more. And so I include this visual just to kind of visualize this a little bit better. And in total for this project, I used 40 sources, and there's no true count of how many I actually reviewed since this wasn't a systematic review, it was a qualitative one. So background context now, so getting into the Internet of Things. So the Internet of Things describes the connection of material objects to the Internet via embedded sensory technologies. It was first coined in 1999 in reference to linking objects to the Internet via radio frequency identification tags. And so IoT really represents a state of heightened communication where objects can interact with one another, but also any end users who want to use them and create meaningful ways of interaction. And IoT is currently being used in a variety of different industries. And as you can see, healthcare is one of them. So the Internet of Health Things specifically applies Internet of Things to healthcare. And it transforms the treatment process by way of sensory machines and devices that continuously monitor and collect patient data electronically. So this is outside of what you would typically see in a traditional care setting where you go to a hospital or outpatient clinic to get that recorded. And this supports more precise clinical diagnoses and decisions that improve patient safety and outcomes. So applications of Internet of Health Things and digital health. So really Internet of Health Things seems to be a foundation for digital health architecture. Digital health consists of any of the applications and media that we try to use as far as improving medical content, commerce, and connectivity. And then I included 4 different areas of digital health. So we have remote monitoring of health data, smartphone health applications, ambient assisted living support. So that's for making patients more independent and able to go after their personal health goals. And then wearable technologies included last. So more on wearable technologies and digital health. So they seem to have emerged at the forefront of digital health just because of their broad applicability in healthcare, clinical research, and personal health education. We see that there's a lot of investments in the billions, with even more projected for this year and into next year. And wearable technologies continuously collect health data using a multitude of form factors. So you see on the diagram, there's just many different ways that you can measure health data and get that data and use it in some way that is clinically significant and beneficial to patients. So problems potentially addressed by wearable technologies. Traditional patient data collection is very narrow in terms of like what it actually covers. And this is because typically if a patient is being seen as in a setting where they're going into a hospital or a clinic, they might have memory recall issues about symptoms or start dates or anything like that. They might have insufficient health information transfer between systems when they move, and this gets into interoperability sometimes. And then inadequate comparisons between the individual and the population health data averages, and this is more of a general scope of how we can see more data going into creating better clinical treatment pathways. So frequent data collection over extended periods of time, as supported by wearable technologies, helps to provide larger and denser data sets. And again, this creates greater quality of data and then a deeper understanding of disease and treatment variability. So wearable technologies in support of the quantified self movement. So this is something that is emerging with a lot of speed. It aims to better inform people about their health through quantifiable self-monitoring actions. So this is most apparent in wearable technologies directed to consumers about tracking their fitness and their health. Sleep comes up a lot, so different things like that. And we see that it offers patients an avenue to understand their health independently outside of what you might see in an interaction with a medical professional. So here I included just a few different products and what their claims would be. And I pulled these directly from the website. So for Apple Watch Series 5, the Proactive Health Monitor, it goes into a little bit more detail about how this can help a patient or anybody really kind of improve their health through these different applications. And I included, let's see, one for the ECG. So wearing an ECG on your wrist at any time, anywhere, similar to a single lead electrocardiogram. And you can see that these claims are kind of trying to make sure that patients know or people know that these things are equivalent with medical devices. Here we have the Garmin Venue Fitness Tracker. So again, more bold claims about capturing health data and improving that through this use of this product. And then some different applications, so advanced sleep monitoring and heart rate sampling as well. And then a third, the Fitbit Versa 2, health coaching reimagined. So this one gets more into a specific part of Fitbit Care. And their claims are that by using this product and the coaching application, as well as the Fitbit Care, that it accelerates health outcomes in comparison to traditional clinical care and anything else outside of that. And this is in hypertensive patients over a year. And then also another claim that they mind the gaps. So some of those gaps that we were talking about with patient data, they're saying that by wearing this Fitbit or wearing this fitness tracker that we can, close those gaps a little bit more and create a more robust patient data repository. So consumer wearable technology claims for medical device equivalents. We see here that the new sphere, or I guess field of consumer wearables, kind of exists between the personal health tracking field and the medical research and clinical practice fields. And these claims are just going more into that these things are equivalent to validated medical devices and that they can improve health just in a way that a medical device would. But should we actually believe these things as much as they say they are and as much as they try to market these to consumers directly? So data output from consumer wearables does not always match data output from validated medical devices. And there's a lot of different studies that try to go into validation and reliability of consumer wearable devices and technologies. One is a 2015 paper on validity and reliability of consumer wearable activity trackers. They found that there's high validity and reliability for steps, but anything else resulted in overestimation in measurement. Again, another one, a 2016 paper about energy expenditure, and this was an underestimation of all the trackers that they tested here compared to a gold standard reliable medical device. But this bottom one here for Apple Watch 3 and Fitbit Charge 2 for heart rate accuracy seems to say otherwise, that they appear to be useful for measurement of cardiac activity. So we see a lot of different competing claims here, and it's kind of hard for consumers, let alone anyone else, like a medical professional or researcher, to kind of get through and, you know, anything out there as far as like what is actually true and what is not. So issues undermining consumer wearable technology equivalence to validated medical devices, there's a few, so I included 4. So there's lack of standardized methodology for evaluation and validation. So certain groups measure wearable accuracy in different ways, and they choose different ways to measure them based on different parameters. And so if nothing's standardized, then nothing actually gets said about what is a good device to use and what is not. There's differences in proprietary algorithms. So certain companies might say, this is my algorithm for processing this data, but another one might do it differently. They might sample things differently, and so that all results in a lot of variability. Testing a device efficacy versus efficiency. So it seems that a lot of these tests for validation are for efficacy in a controlled setting, a laboratory setting. But generally, if we're talking about consumer wearables, these are things that are going out in the world with all sorts of people who have all sorts of different lifestyles, and this probably won't result in, you know, the most validated or the least standardized sort of device if we're testing for that. And then outpacing of validation efforts by wearable development cycles. So right now, it seems that the development cycles are just going really, really fast without much validation. And this is just due to so many iterations of different devices. And I mean, at this point, we're on Apple Watch Series 5, I guess. And you can imagine that if they just keep doing this every year, adding more stuff, that is going to be harder to validate what's already out there, let alone the new stuff. So 2, the identification of key attributes of wearable technologies. So when we think about identifying things, I was just trying to pull some main things that I saw across all the different articles and blogs and publications. One being medical oversight, another regulatory compliance requirements, data output, data processing and interpretation and responsibility, data security, mobile applications, cost, and context of use. And you see that context of use is highlighted, so this is going to come more into play with my project. So 3, identification of use context for wearable technologies. And then we see that there's different types of context for when you want to use these. And context of use is just describing how and in what context you would like to use the wearable technology for what it is intended for. So we have medical practice, clinical research, and quantified self-tracking as the major ones. And they kind of overlap at different points depending on what sort of work you're doing. And this can be the basis of what you use as far as like comparing one wearable technology to another and seeing if it is appropriate for what you're trying to do. So for the qualitative comparison of wearable technologies based on use context and key attributes. So this is a result of what I did this summer, basically just every day trying to read through what I had collected as far as articles and publications and picking out the salient points and adding them to this chart, just to make it more easier for anybody else to read through and kind of get the general gist of it. But this information is made more presentable in this little diagram that I created. So we see a spectrum or continuation of wearable technology characteristics with wearable medical devices all the way at one end, and then consumer wearable technologies at the other end, and then research grade in the middle. And we see this is because really that wearable medical devices and consumer wearable devices are kind of different in the things that they represent and have as qualities. So these are typically used in the healthcare setting only for medical devices, operated by trained medical professionals, produces raw data, but may have some preliminary interpretations, such as some sort of impression given off by maybe an ECG machine or anything like that. Data interpretable by medical professionals, strict FDA clearance, strict HIPAA regulations for data sharing. So typically none of the data would be shared in any sort of way unless it was medically relevant or harmful for someone else. And then no associated mobile applications. And then at the other end, for consumer wearables, we kind of have mainly the opposite of everything for medical devices. So used anywhere, can be operated by anyone, produces data that is processed already and has interpretation. This is due to the algorithms that I was speaking about earlier. No strict FDA clearance. There are a few things that might need to be done as far as like passing clearance in terms of reference device, but typically is not as strict or stringent as what you would see for medical devices. And no strict regulations for data sharing. So that is a big thing that comes up with data security and how patients or people give up their data and where it goes and what it's used for. And then there's many associated mobile applications, and this just seems to be a trend that happens with any consumer wearable going out now. And then they are much lower in cost. So typically in the hundreds versus the thousands for medical devices. And then research grade is kind of in between. You kind of get a mix of different attributes at different times depending on what research studies you're trying to use them for and where, what diseases and things like that. So my proposed definitions for wearable technologies, I made this diagram to kind of make it a little bit more clear. Clinical grade wearable technology, and this is designed to support medical services and research through an enhancement of communication of patient health data. And specifically within that, we have wearable medical devices, and that supports the delivery of healthcare services and also supports diagnoses and treatment decisions. And then we have research-grade wearable technologies that are typically used in clinical trials, and they have to do with things about like protocol adherence and patient tracking, but also may inform a clinician's decisions. And then all the way by itself, consumer wearable technology, it offers increased connectivity to internet services generally, and is designed to add some sort of convenience to daily life, but may also go into something that is more health-like or educational or anything as far as lifestyle goals, but doesn't do that definitively. So considerations for wearable technology usage. So it's important to understand the performance characteristics and the context of use of wearable technology if you want to use it optimally. And then these are a few considerations that me and my mentor kind of came up with as far as if I was to speak to someone that was considering buying one for a certain reason or a certain cause. So one is always, what is your context of use? What are you trying to measure or observe? That definitely plays a part into what you're trying to get. What device is capable of capturing the data intended to answer any of your questions or what you want to observe? How accessible are the data that is collected or stored by the device? So if it's raw, unprocessed data, then you kind of want to have that and have someone on hand to interpret that for you. How likely is the device to be used? And this goes more into the patient or person side where you have to deal with compliance. Is it going to be high cost or low cost? Is it available? Things like that. And then parting considerations. So for any future research or anything building off of this project would be, in what ways should we try to validate wearable technologies? Is quantitative validation equal to better outcomes for use? How should we weigh efficacy versus efficiency when seeking to validate these technologies? Should we hold wearable technologies of different use contexts to different standards of validation? And does every device need to be clinically validated to improve health? This is just a few slides on my internship. So I included some pictures from the first day, as well as a little blurb that they wrote up about us at the end. This was my poster presentation at the showcase at RTI, and that was just mainly all the interns from that summer present their work over the course of 3 hours to staff and anyone interested. And then this was my presentation to the health informatics seminar that we're currently doing with Duke. And then it was kind of a brief summation of what I presented here today. And lastly, thank you to my mentors and to Dr. Mustafa, my advisor for the program. Thank you.